Amyotrophic lateral sclerosis, ALS. Amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease, is a progressive neurodegenerative disease that affects the nerve cells in the brain and spinal cord. It is a rare disease, with an estimated 5,000 new cases diagnosed annually in the United States. ALS is a disease that gradually hinders individuals' ability to move, speak, swallow, and breathe. The prognosis of ALS is guarded. Symptoms of ALS typically begin with muscle weakness or stiffness, often in the hands, feet, or limbs. As the disease progresses, the muscles become weaker and eventually waste away, leading to difficulty with movement, speech, and swallowing. In some cases, ALS can also affect the muscles that control breathing, leading to respiratory failure. The cause of ALS is not fully understood, but it is believed to be a combination of genetic and environmental factors. In some cases, ALS is inherited, with mutations in specific genes increasing the risk of developing the disease. However, most cases are sporadic, with no known genetic cause. Diagnosis of ALS is typically based on a combination of clinical symptoms and tests, including electromyography, EMG, and nerve conduction studies. These tests can help identify the characteristic patterns of muscle weakness and wasting associated with ALS. Currently, the management of ALS is focused on alleviating symptoms and improving quality of life. Medications such as riluzole and edaravone have been approved to treat ALS and can help slow the disease's progression. Other treatments may include physical therapy, speech therapy, and respiratory support. Despite the challenges of living with ALS, many individuals with the disease can maintain a high quality of life with the help of supportive care and assistive devices. These may include mobility aids such as wheelchairs and walkers, communication devices such as speech-generating devices, and feeding tubes to help with nutrition. Research into the causes and treatment of ALS is ongoing, focusing on understanding its underlying mechanisms and developing new therapies to slow or halt its progression. In addition, advances in genetics and molecular biology have led to a better understanding of ALS's genetic and molecular basis, and new drugs and therapies are currently in development.